All right, so we're going to get started. So as you can see here, we're celebrating 125 years of chiropractic being a profession. So that is absolutely awesome. We're also celebrating the very first snowfall of the year here in northern Wisconsin. So it looks like we have a solid 2 inches and it's still coming, so watch out for your winter advisories. This was supposed to be to welcome in the fall. We're already skipping to Christmas, guys. So first thing we're going to get talking about is a little bit about the basics of chiropractic. Since it is its 125th anniversary, we got to get into the anatomy of it. So here we have our beautiful spine. We have it in every single room, I think, at the office. We have our spine. And mine's looking a little cattywampus, but I'm going to do my best to bend it. This thing's strong. So we're going to go through the anatomy of it. So right here we have our vertebrae. These are the big blocks right here. We have 7 cervical vertebrae coming through here. We have 12 thoracic vertebrae. And then we have 5 lumbar vertebrae. And what these guys do is they come around the entire spinal cord, and they actually protect the spinal cord, but they also are a basis of function for movement and flexibility. So each one of these categories has a different job, and they move in different ways. In between all of these, we have our discs. And discs are amazing because these are our shock absorbers. And the discs are hard around the outside with annulus fibers, and in the middle, they're this like gelatinous material. So one of the big things that discs have is no blood supply. So that is why we're going to be talking a lot about movement and why movement is so important. So coming through these discs, you can see the little yellow thing going through here, and that is our spinal cord. Our spinal cord is our communication highway between our brain and the rest of our body. So these little guys here, if you were to open up a cadaver, they look gigantic, right? Like these look like huge yellow nerves. But these nerves actually are tiny in a cadaver. They have tissue, they have fat, they have a bunch of stuff that's actually surrounding them. So when we looked in cadavers, I was like, where are the nerves? They're supposed to be these big yellow things. Not at all. They're actually really tiny. And what these do is they communicate to the rest of your body, and they tell our brain and our body how we're supposed to act. So our smell, our touch, our movement, where we are in space and time, this is what's causing it, our brain, spinal cord, and then all the movement through here. The other thing that happens is it connects to our organs. So we have a ton of functions that come through our spine. So that's a big thing. So quiz, you can't see it here. So quiz, how many cervical vertebrae do we have? Breakfast, lunch, and dinner, 7, 12, and 5. I never get that 5 right. So what's up with the curves? So we're going to talk a lot about curves. And one of the big things is my spine doesn't look like it's very curvy right now. But this guy is. So what the curve of our spine does, we have a cervical curve and we have a lumbar curve and our nice kyphosis right here. So a curve technically going the other way. And what this does is it supplies balance and support for us. So if these curves are not functioning right, so one of the most common we can use is this example of scoliosis. What happens to those nerves that we just talked about that don't have a lot of space to move is they have an interference. And this interference can be caused by the weight of a dime. But if we don't have the nerve supply to our organs, to our body, we're not going to be functioning at 100%. So that's where we start seeing disease or dysfunction happening. So we're really going to be focusing on today why these curves are so important and how they form. And this starts out from the womb, so very little babies. Here's this cute little guy here. So we're going to put the spine in kind of a little bit of a different position. So when a baby's born, their spine is actually in a C like this. So we have one big curve going on. And this is because it's safer in the belly for the womb, and it's how they fit into the womb when we're getting ready for birth. And one of the big things is at 3 to 4 months, we get our first curve. So how many of you guys have kids here? Everybody? Yeah. How much do they all like tummy time at first? No, they didn't at all. So what that tummy time is doing and what their very first curve is actually their cervical vertebrae, those 7 vertebrae. And what you're doing is you're putting your baby on his tummy, and now we have to develop the very first curve of your spine coming up through here. And that first curve has to develop, the muscles have to catch up to it, and that's why tummy time ends up being so important. Now, babies don't like it at first because do you like going to the gym when you haven't gone in a very long time? Your muscles don't agree. It's a slow transition. You're like, oh my goodness, holy smokes. That's kind of what babies have to do. They have to get their muscle to catch up with them and their bones to do what we want. So tummy time, we always say at least 5 to 10 minutes, 30 minutes a day, and then make it entertaining. So here we have a lot of stuff here. So this is like a hula hoop sensory little thing, and it actually makes it so it's super fun for babies to be on their tummy. And you can even get nice and low with the baby too. So if you have grandkids, if you have anybody, promote that tummy time, even if it's a little bit of a fussy time. Our second curve is actually our thoracic curve, and then our third curve is our lumbar curve. So this forms by age 1, and what we're doing here is we're actually getting this curve by crawling. So a lot of times we try to promote our kids, oh, we're going to get them walking, or my kid walked really fast, which is great, but sometimes our spine isn't ready for it because we need these 3 curves to support the balance of our body. My spine's kind of getting a little cattywampus. It actually snapped in half when we were on our way back from Atlanta. So the spinal cord isn't actually attached in here. So this thing's like kind of a little wobbly. But so for a baby to be crawling, we're scooting and getting that motion. That's where we start seeing that curve forming in the bottom. And one of the things that we like to do with babies is get on the ground and actually crawl with them. So if you're on the ground, or you can promote, like, instead of putting them in little containers, and we're going to talk about that, we want to get them moving through different ways. So the containers are a big thing. So these are things that actually will not help a curve. So if we put a baby in like something that holds their head up or kind of lays them flat like this, we'll actually see where their curve starts going up, and we start losing the curve that we're supposed to have. So we work so hard on that tummy time to get that curve nice and pretty, and then we set them in things like this, and we promote the opposite reaction. As babies developing, sometimes we like to put them in little jumpy things. And when we were in school, we always learned that the jumpy things were super bad for your hips. So as you have them on the jumpy thing, one, they might not be ready for it, so we're putting excess weight onto their spine when they're not ready for the weight to be on there. And then also, too, it jams up and sometimes can cause a pars defect, which is a fracture of the spine. So if we have that going on, we really, really don't want to be promoting that. Kids develop all at different ages, and they're all individual on how they're going to pop. So I say they're kind of like popcorn. I'll do all the kernels pop at the same time? Not at all. So we have to wait for our kids to develop how they're supposed to be. One of the big things is our curve is developing on throughout life. So it's not just when you're 1 year old. We have to concentrate on this as we turn into adults because our spine continues to grow past puberty. Right here, just to recap, so we start out as a C. Tummy time and working on our crawling and everything here help with the neck, so 3 to 4 months. Then 8 to 9 months, we get our kyphosis in our middle of our back, which is our thoracic spine. And then we go to our lumbar, which is our crawling and moving around that way. And we work on this throughout life. So how many of you guys have been still working on your curves? I do every single day. And I'm a grown human being, so it'll always be a project. So that's just saying we're still working on it. So what can affect? So now we're getting through, we're past year 1, and now it's time for our child to go to school, or they're getting older, right? So now we have to think about what else we're doing in their daily life that can promote a bad posture or for the curves not to be in the right direction. So one thing is backpack wear. Is it 1 in 7 kids will end up in the hospital due to improper backpack use? It's some insane number. I can never remember numbers. I'm horrible at numbers. But basically, when we are putting too much weight on a kid's spine, it's not good for it. So usually you should have 5 to 10% of a backpack weight in their backpack. The other thing, if you can see right here, this backpack's way too high, and the little girl's slouching forward. So we can go over on backpacks. We probably could almost do a whole separate talk on backpacks. But one of the big things is that we have to start looking at daily habits that our kids are doing to promote a good posture in their spine. All right, so this is pretty apparent. So one thing that you can look at when you're looking at your child's spine is symmetry. So basically, we're looking at a child's shoulders here. In this kid, it's very, very obvious. But this child has a scoliosis. And if we look here, this boy is nice and even. Actually, I think it's the same boy, but he went through chiropractic care. But so you can see his scapulas are uneven. His hips, one high is higher than the other. And it might be even a little less, like you can't notice it as much here. But you start looking for those changes on your child, and that might be a good indication that they should be under chiropractic care or really having their posture addressed. Then we're going to go to this one. So how many 3 to 5-year-olds know how to use a cell phone better than us adults? I have a lot of kids who can log into anything and do whatever they want on a cell phone way easier than I can. So one of the big things that we're seeing is that our posture starts doing that thing exactly the opposite of what, so we work so hard, tummy time, we got our curve, and then now we're adding technology into the mix, and we're putting our head just like this. What does that do to our neck? It completely straightens out our curve and makes it so we're having dysfunction. I can't breathe as easy with my head like that. There's a lot of things that are going to struggle if my head is completely down like that. So we also see unicorn horns on kids. This is actually from ABC, or one of the big newscasters. They actually, and the link's down here, but they started finding little horns in the back of the head on kids and adults who had their neck straight like this. And one of the things that happens is I want you to picture a bowling ball. So bowling ball is easy to carry when it's like this, right? Super easy. I can walk around all day with my bowling ball like that. But as soon as my bowling ball starts going forward, it starts weighing more and more and more on my arm. My muscle starts to build up here, and now it's having a hard time holding that. That's exactly what happens in our neck. Our head is like a bowling ball, and it gets heavier and heavier the farther forward we are. So with kids, their trapezius muscle actually attaches into the back of their occiput, and we'll see pulling from the muscle because it's trying to compensate on the bone, and they get these unicorn horns. So that's a sign that we really need to work on our posture, and that's when I say, Mom, be the posture police. So have your kiddos. I'm like probably the most annoying person to my 15-year-old sister-in-law, because I'll walk by and be like, posture police, like deep voice and all. And I'll have her, because you'll see this, and then so either lift up your phone and have it so it's here, or even stack up pillows so that you're not leaning all the way down. Because as soon as we get in that land of what we call the slumpies, that's where we see a fault in our posture and more tension on our spine. We're losing our good curves. All about the curves, guys. Right here is what we call a subluxation. So it's just showing that when we do have those postural changes, you can actually see muscles getting tighter on one side of the body. So it'll actually affect our whole body when we start seeing our curves being lost. So I'm going to challenge everyone now. This actually, it's from the Art of Manliness, but this is what I call like a semi-wall angel, and this is an exercise. So what you should have your kids do, or you do, is you stand against a wall, put your buttocks to the wall, put your shoulders against the wall, and your head, all at the same time, and have your feet about 6 inches out. Don't lift up your head, don't lift up your shoulders, nothing like that. So if I were to stand against the wall, I'd almost be flat against the wall. If I cannot put my head against the wall or my shoulders against the wall, that means I definitely need to work on my posture, and my shoulders are most likely too tight. Obviously, you'd want to there are some exceptions, but that's definitely something to work on, and that's actually an exercise too that I give a lot of my patients. So mind your posture. We have curves in our body that we need to keep safe and that we work on and work on and work on throughout life. So Dr. Aaron's going to be talking to you. Dr. Aaron's going to be discussing a lot more about that. So thank you for listening. What, you got these? Perfect.
Okay. Thank you.
Yeah, you can take that. It's like a guitar.
All right. Dr. Lexi did a great job starting out here presenting. Just put this in my pocket. Makes my job a whole lot easier when we have a good intro. So a couple things that I'm going to go over, and she had mentioned that term. It started with an S. Do you guys remember what she said? Yep, subluxation. In fact, sometimes in some chiropractic circles, it's like, well, we want to use a different name. That name is outdated. And I joke around, well, let's call it a Steve, intersegmental dysfunction. You can call it a bunch of different things. We'll use one vertebrae right in the middle here. Fancy term called juxtaposition. So basically, when you have one of these joints that goes out of position with the one below and above, this is where problems can start to arise. Okay? And for a lot of people, it's like, well, how does this start in through here? And so the founder of chiropractic, D.D. Palmer, he thought there was actually 3 different causes to misalignments in the spine. One was thoughts, one was trauma, one was toxins. In fact, the last seminar that I went to, and hopefully this can be seen here, So it was a lady presenting, and it was more so on female health and different supplements you can take. She thought all problems, instead of thoughts, trauma, toxins, came from mechanical, emotional, and nutritional / chemical. Now, it was a women's seminar, so she said all the problems in the spine start from men. And she got a laugh from all the ladies, and I didn't laugh, but I smiled. But so in chiropractic, typically when we're taking care of the spine, a lot of the trauma that we see is mechanical. And for some people, they may notice car accidents. Boy, their neck might have got hurt. Those that played sports in school. Those are called macro trauma. Just like you can have macro trauma, though, you can actually have what's called micro trauma. Let's take the lower back and pelvis, for example. What happens if I stood on the same leg every day? What happens if I crossed the same leg every day? What happens with the snow outside if I shoveled only one way? In fact, 2 days ago, even though it's snowing out there and there's a couple inches on the ground, I was golfing. What happens if I swung the same way and never swung the opposite way? Microtrauma can result over time in eventually forming a misaligned pelvis, and then different areas of the body compensate, as Dr. Lexi had showed on her presentation. So we always talk about, when taking care of the spine, not just with these curves right here, but also looking straight up and down, what we call the rule of opposites. So if you notice yourself or your kids or that, a lot of us have a favorite leg we stand on, or a favorite leg we cross. Try to make sure you're switching. If you're shoveling, shovel both ways. Guys, we like to sit on a wallet on that back left pocket. I put mine, that was the very first piece of advice my first chiropractor told me, take the wallet out of the pocket, put it in your front pocket, or at least while you're sitting or in the car. So rule of opposites is something, in those of you that are patients here, you've heard us say it ad nauseum. Rule of opposites, rule of opposites, rule of opposites. In fact, if I have a rotated pelvis and it's been this way in 20 years, we get people that coming in that say, well, you should be able to fix it in 1 or 2 visits. If I'm a miracle worker, I can. And this is why infants and kids respond so much quicker to chiropractic care. They don't have that muscle memory built up. So that's why we give you guys exercise in that, in addition to what we do in the office here. So as far as the spine, if I have a misalignment in there, how do I take care of it? Kind of like if next month I go see my dentist across the street and I have a cavity, is he going to tell me, take some pain pills and just don't drink cold water? Well, no, he's going to go there and fix it. If I have a misaligned spine, I can't chemically treat it, I have to mechanically treat it. And this is where a chiropractic adjustment comes in, and where we actually start to mobilize the spine. As far as additional things that you can do with a misaligned spine, in addition to seeing the chiropractor, we're usually going to recommend something to control inflammation, primarily things like ice. If you look at the American diet, very inflammatory, we actually may recommend some supplements that are anti-inflammatory. Other things in the office, we may work on some things that deal with soft tissue. Because as I go back to the spine, even in the pelvis, because it's the easiest to see, if I have a rotated pelvis like here, and I have muscles that are compensating, I may have to work on the muscles in addition to the joints. So this is where sometimes we'll have patients, they get massage therapy and they get physical therapy. They're great complements to what we do. That's also why we offer active care in the office. Because if I've had a problem for 20 years, I may have only had symptoms for a year or two, but I may have had a problem that started from a fall off my bike when I was 5 years old. It takes time to heal that area. As far as soft tissue healing, so let's say I sprain a joint in my back, or say an ankle in my foot. How long does that take to heal?
6 weeks.
6 weeks? Yeah, 6 weeks is a pretty good guess. So we actually have 3 different main healing phases. So one is the inflammatory phase, so I just sprained my ankle, and we'll ignore the phase before that, bleeding and stuff like that. But I have an inflammatory phase that's 1 to 3 days on average, up to 6 days. So the body's going to swell, it's going to bring white blood cells in through there, it's going to start to clean it up. But then that 6 weeks, yeah, that's the repair phase, or what's called the proliferative phase. It'll take 6 to 8 weeks. And that's why a lot of times our initial patients, we'll see them for around that 6 to 8 week phase. To completely heal the joint, though, it'll remodel for up to 2 years. So normally when we sprain an ankle, things like that, yeah, I might feel better after, say, a few days or even a week or so with icing, but it's going to continue to heal. And if we don't heal it properly, we end up with a weaker joint. Okay. As far as that remodeling phase, primarily we'll talk about collagen. So when it comes to collagen, you actually have close to 30 different types of collagen. We'll focus in on, most researchers say there's 5 types. We'll focus in on the top 3. So number 1 is collagen 1. That's what takes place in 90% of your body. So if you think of collagen on your skin here, this is good, healthy, type 1. Hopefully it's still healthy here right now. I try to take my supplements and eat good. Hopefully stave off the wrinkles for a while. Type 2 collagen is typically what we see in the spine, in the disc here. And type 3 collagen is right alongside type 1 collagen. That's oftentimes if part of it when I get a scar. So just like I sprained that joint, my body's going to throw type 3 collagen right away. It basically wants to seal up the joint. We don't want to bleed out. And then eventually it's got to remodel into type 1. So the last part of my talk is how to maximize collagen formation so we can get into that healthy type 1 collagen. Well, number 1, I have to provide a need for it. So let's say I sprained my wrist. If I just kept it locked in a cast, what would my wrist look like after 6 weeks? It would be shriveled up, it might be atrophied in that. So the body heals around motion. So as long as I can start providing motion to that joint, in fact, say I get a whiplash and I start getting adjusted right away, that'll help speed up recovery time. We always tell people as far as motion goes, stop at the point of pain. You don't want to be, no pain, no gain. The other thing that you can do as far as speeding up healing is making sure that you're getting the right nutrients to make collagen. So if you look at the most proliferative protein in the body, it is collagen. But let's say you're not digesting your proteins. Let's say you're not ingesting enough proteins, and let's say you're not breaking them down. So as we get older, we produce less collagen. I like to think of collagen almost like in reinforced concrete, almost like the rebar. It gives strength to it. So as we get older and we produce less collagen, what do we see more of? We see more wrinkles around the eyes and different areas, and that's a breakdown of collagen. And we produce less of it as we get older. Well, collagen is primarily made out of 3 amino acids. Okay, we have glycine, we have proline, and hydroxyproline. Well, let's say I'm not eating those nutrients, and more importantly, if I'm not breaking them down. And one of our talks that we've talked about digestion before, you are what you eat. Even more important, you are what you absorb. Kind of like taking a really cheap supplement that goes in one end out the other. If you don't break it down, you're not going to absorb it. This is why as a person gets older, they've used apple cider vinegar for years to help lower stomach pH. Zypan is probably our most popular digestive supplement here, especially if I have a heavier protein meal. I always joke around the time I finished a 3-pound burger down at Milwaukee Burger Company, not advising it, but before I went to go eat that 6 years ago, I took 3 Zypan. So if I have a heavier protein meal, I'll actually take something to lower my stomach pH. This is a big problem as we see people getting older. What are they taking? That little purple pill. Does anyone know what that's called? Nexium. We see more people on Nexium, omeprazole, basically proton pump inhibitors. If you're actually inhibiting your body's production of acid, you're going to inhibit not just your absorption of minerals, which can lead to muscle pain and eye twitching, muscle twitching, things like that, but you can't, pepsin and pepsinogen, as far as activating, it takes acid. And if you don't have enough acid, you're not going to break that down. So this is one of the things, in addition, apple cider vinegar with a meal, we'll usually start with. One of the most popular supplements in the days of Amazon, and it seems like everyone shops online right now, is collagen. And collagen, not just because it's good for the joints, but it's good for hair, skin, and nails. So we see, as long as it's cosmetically good, people buy it. But if I can have something with collagen and I can combine it with something like a glucosamine, this is where sometimes we'll see people with a chronic knee issue. Just by taking collagen with a glucosamine, even more so than a chondroitin, this is where sometimes after 4 weeks, and especially if someone stays on it for up to 2 months, you may notice the difference not just in things like hair, skin, and nails, but also as far as the joints go. I also advise supplements are meant to supplement the diet, not replace it. So if you're eating McDonald's every day, don't go out and buy supplements. Start with getting a good quality protein, whether it's pea protein or grass-fed beef or wild-caught game or wild-caught fish, and combine it with something that's going to help break down protein, something like digestive aid. So those are the best things you can actually do to help supplement as far as the joints go. Last things I have on my list here, Hyaluronic Acid Msm, a couple of other things. Probably one of the big things nowadays, especially with everything going on, cold and flu season. So normally we talk about what a person needs to stay healthy, vitamin D for prevention. But let's say I come down with something, I'm big on zinc and vitamin C. Zinc, vitamin C, and copper actually are needed to make healthy collagen. So those of you that are already taking vitamin C, in fact, if you're really, really low on vitamin C, we saw this back in the day with sailors. What kind of disease did they get? Started with an S. Scurvy. You know, you remember the pirates, scurvy dog, okay? And that's why, and I learned this from Dr. Bouch and his library of knowledge, but if you look at the British Navy, why were they called limeys? Well, they gave him limes for the vitamin C component. So really low vitamin C, you can actually see how it affects collagen. You get bleeding gums and that. So even just a little bit of vitamin C every day, you only need 100 milligrams. For some people that are under more stress, they need a little bit more. But those of you that are taking things like vitamin C this time of year for cold and flu prevention, it's also good for making collagen. To continue on with the talk, I will bring up Dr. Matt. Dr. Matt, I'll switch with you.
All right, so as Dr. Aaron said, I'm Dr. Matt. I'm going to be kind of continuing on the topics. What I'm going to be kind of covering is, some of the dangers of inactivity. That includes, any sedentary lifestyle. For most of us, it's going to be sitting. I'm going to talk about some of the proper, positions we can do, stand-up desks, sitting, proper ergonomics with that. And then also just, some simple tricks, and tips, like rotating your posture while you're sitting and some little posture exercises we can be doing. So, so what are some of the effects of sitting or inactivity? So if you sit for as little as 2 continuous hours, you increase your risk of heart disease, diabetes, cancer, back pain, neck pain, just to name a few. And so another thing with sitting, unfortunately, if we sit all day and go to the gym, get a great workout in for an hour, it doesn't erase the effects of sitting all day. Especially if you go home and sit for another couple hours at the end of the day, we're still considered sedentary. I'm not saying stop when working out. I'm saying improve the other parts of your life. When the typical seated office worker has more musculoskeletal injuries than any other industrial sector. This includes construction workers, factory workers. So that's when you line up, when you think of the physicality of some of those jobs compared to sitting, you really get a good idea, how damaging it can be sitting. If you don't think this will affect you, odds are it will. 8 in 10 people will experience some kind of back pain, and back pain is the leading cause of disability. And so, also the World Health Organization ranks physical activity as the 4th biggest preventable killer globally. They estimate 3.2 million people die from that. So that's a pretty impressive number when you really think about it. So why is posture so important? Our joints and our tissue will adapt to the posture that we assume all day. So unfortunately, you see a lot of kids, school, technology, this is the posture that they have adapted. When you think, the average American spends 13 hours a day sitting. So that's, 24 hours a day. That's the largest chunk of probably what people are doing in the day. So that really becomes important because although the joint will adapt to that position, the muscles will get tight, as some of the other doctors, the collagen will form differently. And so when we get adapted to that position, it becomes really difficult to change that position. So, it's better to prevent something than trying to change something. And kind of, where does this really, start to be affected? If they've done a really good job throughout life, they've listened to Dr. Lexi, they've formed their curves. First grade is kind of when we really start to sit, in class for extended periods of time. So if you have any young kids, really make sure you're hammering posture with them. If they can't get a stand-up desk at school, try to do that. Some of the, most common, probably poor posture positions that we see in the office are the flex posture or, kind of the rounded posture. This is turning that S-shaped curve back. We're kind of de-evolving, going back into the C. And this puts a ton of stress on the base of the neck. In different parts of the spine, we start rounding the shoulders. This is too where we can start seeing that bump form in the back of our necks. And like Dr. Aaron was saying, a lot of people buy collagen because hair and nails, people are worried with how they look. Well, if you're worried about nothing else, worry about how you look. Have good posture so you don't get that bump in the back of your neck. Some of the common conditions we see, with the poor posture, the rounding of the spine, the forward head flex, is we get a loss of range of motion. When you're in this position, you're just not going to be able to move the way we're designed to move. We get breathing issues, and we probably don't think of that, but not only mechanically are we affecting the spine. When we start flexing forward, we collapse our rib cage in, we start compressing our diaphragm. We can't breathe the way we should, but also neurologically, we're affecting the way the diaphragm moves. The nerves from the neck come down and innervate the diaphragm. So if we're stressing the neck up here and mechanically shutting down our diaphragm, we're not going to be able to breathe the way we should. And so, if you've ever never heard of diaphragmatic breathing, that would be something to look up. That's something you can practice, focus on throughout the day. We can get numbness and tingling in our arms, hands, fingers. Same thing, all the nerves come out of our, as Dr. Lexi was saying, come out of our spine. They come out of our foramen and our vertebrae, go down into the arms and the shoulders and neck. If we're putting tension on the spine like this, rounding our shoulders, we're cutting off a lot of spots where, we can get compression in it, and, that's where we can start getting numbness, tingling in the arms. Also neck, kind of obvious neck pain, back pain, headaches, a couple other things that you probably didn't realize, we see a lot of shoulder pain and TMJ issues from poor posture. I'm going to have you do this with me. So stand up with good posture, pull your shoulders back, pull your head back. So raise your arm like this as high as you can. Not too hard to do it like that. Now round your shoulders forward like this, put your head forward, and do the same thing. It becomes much more difficult to get through a clean range of motion. You can feel a lot of tension that it puts on, and so as you go through a lifetime of putting more mechanical stress on your shoulder, that's where we start getting those shoulder injuries later in life. But also as an athlete, your shoulder becomes rigid, not as flexible when you get hit, say in a contact sport. Same thing with the TMJ. It's easy to open your mouth when you're standing with good posture. When the head comes forward, same thing as with the shoulder, puts a lot more stress. It's harder to get through your full range of motion, and that's where you can start developing jaw issues later in life. So what is good posture? Good posture is standing good neutral position. Your ear should be over your shoulder should be over your hip over your knee over your foot. Your butt should be engaged, your core should be engaged, and your shoulders should be engaged and rounded back. So, that's proper posture. So ideally, if that's proper posture, when we're at work, we'd have a standing desk. I know not all of us can have a standing workstation, but if you can, how you set it up would be, when you're standing, the computer monitor would be at eye level. The top of the monitor would be right at your eye. Where your arms will be, nice relaxed at your side, 90 degrees of the elbow, arm parallel to the floor. This will be the monitor. You want the keyboard close enough to you where you don't have to reach for it, the mouse close enough where you don't have to reach for it. If you can, a stool's wonderful to have, because then you can lean on it during the day. That would go up to the top of your butt. And then if you are somebody that's just starting out with a standing desk, build into it slowly, just like going to the gym. You're going to have to get your muscles used to it. Start 20 minutes out of the hour and build up from there. If you're not lucky enough to have a standing desk, sit the best you can, with the most, the best mechanics you can. Same thing, upper body is going to be the same. Monitor is at eye level, arms, shoulders like this. You're going to be sitting, with the knees 90 degrees to the floor, and then, your hips, your legs 90 degrees as well. When you're sitting, how to sit on the chair. Ideally, you hear a lot about office ergonomics, expensive ergonomic chairs. We have a really nice, ergonomic chair that Dr. Bouch got, a couple $1,000 chair. It's awesome, very comfortable to sit in, but it's still sitting. So when you're sitting on a chair, if you've ever had a kid sit in your lap and you're like, boy, they have a bony bed, it starts hurting your thigh after a while. That's the bone you want to be sitting on when you're sitting. When you're sitting on that, that's preventing you from rolling your pelvis too far forward or hyperextending it, so you're not putting too much of an arch in your back. So sit on the bony part of your butt. Try to avoid using the backrest on the chair. This will force you to engage your spine muscles. Actually, you'll stabilize your spine yourself. If you can, sit on the edge of your chair. This will prevent you from sitting on your hamstrings. We're not meant to sit on our hamstrings. This is especially important. D1 athletes sit all day long, so it's not uncommon. So you're not surprised when they get injured on the field. If you sit on them too long, it's going to affect that muscle. It's going to shorten it up, tighten it up. So avoid sitting. Sitting on the edge of the chair will try to prevent you from sitting on those hamstrings all day. Avoid using your armrests if you can. If you have a chair, just a hard back chair with no armrest, that would be kind of perfect. You don't need to spend a ton of money on a chair, because sitting's still sitting. If you're forced to use a laptop, like unfortunately a lot of kids are right now, using their Chromebooks through school, or a lot of people that are at home, because they can't be at the office, Ideally, we'd have a separate monitor from the laptop or a separate keyboard. That way we can get creative. You can put some boxes on your kitchen table, get that monitor up to eye level, and you can still have the hands in good position. Probably the worst position is, I go home, like Dr. Lexi was saying, my little sister, I catch her sometimes on the couch with the laptop sitting there. She's probably sick of me coming home and yelling at her, but, it's important. It really has major, effects later in life. And so, if your kid's doing that all day long, really try to, gently coax them into, sitting with better posture. So, kind of some tips, to keep your body healthy, during the workday. Fidget often, you're going to drive the teachers nuts, but do it anyways. Change the position you're sitting in as much as you can. If you have a stand-up desk, you can get a little box, put your leg on it during the day, switch the leg, every 15-20 minutes. Just work on balance, stand on one leg, put the armchair back, spread your knees out a little bit. Just constantly change the posture you're sitting in. This will increase circulation in the body, and you'll prevent you from overstretching or overstressing any kind of tissue in your body. If you're one of those people, I've never had this problem. I've never been able to focus more than 15 minutes at a time. But if you're one of those people that you hear that they'll work for 5 hours, say they forgot, really sore by the time they get up, set a timer on your phone. Every 15 minutes, set the timer, get some posture breaks in, or get a posture buddy in the office. Have somebody else that you pick in the office, work on your posture together. That way you guys can make sure somebody's not sitting there for all day long slouched like this. Use a gym ball if you can. This will give you a little different, sitting dynamic. Take micro breaks. In our office, we teach a lot about micro breaks. What a micro break is, it's just a simple little stretching break where, a nice big shoulder roll, pull the shoulders back, pull the arms back, hands on the hips, just stretch back, look up towards the ceiling. Just hold that for 5 seconds. And that's a real simple exercise where we're getting the opposite posture. It's good for the discs in the spine. It's good for taking stress off the joints. Or some other simple stretches. We'll call it the Dracula Superman. You roll everything forward, open up everything nice and big. This opens up that rib cage like we were talking about that gets compressed sitting like this, but also works on the mid back as well. Focus on your breathing properly. When we breathe, our stomach should expand like this. A lot of us breathe through our chest, but a proper breath is, take a deep breath in through your nose, your stomach's going to expand, and we breathe out through the nose. So, sitting through through the workday, just focus on your breathing. That'll help your mood. It'll help you relax, but also, it'll help make sure you're getting oxygen throughout the body. So another little exercise I like, it's really simple, really easy, cheap to do. This is just a little hand towel. What I did is I rolled it up and I taped it so it would stay like this. With the forward flex posture, like Dr. Lexi was talking about, we start to lose it if we do this too often. We call it, it's called text neck. Ways to help keep that curve are, constantly work on it. So this little exercise helps get motion through the base of the neck, try to prevent that scar tissue from building up there. So the first part of this exercise is you suck your chin back, you try to give yourself a nice double chin, you pull it straight back. And the reason that's important is if you don't lock your chin, you're just going to be bending the top part of your neck. We want the motion through the base of our neck. So tuck the chin back, you're going to pull back on the towel, pull down on the towel as we bend back. You can stop when your chin's pointing towards the ceiling. Hold that for about 10 seconds. Relax. Do this throughout the day. Keep the towel by you at your desk, you at home. That way we're working on that motion throughout the day. If you could do it 100 times, that'd be awesome. And then, just a good rule of thumb, every 30 minutes that you're stationary, get up, walk around the office, do some squats, lunges, or just, take a walk to the water cooler and come back. So kind of, little simple recap. Reduce the optional sitting in your life. Optional sitting is going home at the end of the day, sitting on the couch. Sit on the floor, sit on the gym ball, stand while you're watching TV. Try to avoid that optional sitting as best you can. Every 30 minutes, get up, do 2 minutes of exercise. Something to change your position, get the blood flowing. Prioritize your position mechanics because, like I said earlier, whatever position we spend most of our day in, and that's the position our body is going to adapt, and it's going to be really tough to get out of that position. And then, lastly, perform at least 10 to 15 minutes of daily maintenance. That's the micro breaks. That's the cervical exercise like that. That's rolling out a tight muscle, doing a stretch. The more we invest in ourselves when we're younger, the better we're going to age. And so that's my part. Dr. Bouch is going to finish it off. And you're interested in most of this topic, information I got was from a book called Deathbound. It's a great resource. So Dr. Bouch is going to take it from here.
Thank you. Such good stuff. So I'm just kind of lined up. So I'm going to talk a little bit about the history. Then I'm going to go about picking a bed out, and what happens when we're not sitting at night is just as important as anything. So I'll go through that. We'll talk about backpacks just a little bit more. Something that's near and dear to my heart. I've probably done 300 interviews just on backpacks alone. Great subject. The whole country's talking about posture right now. I did an interview for the New York Times this last month. I did one for the Washington or the Wall Street Journal. I also did one today for a paper out of Texas. So again, lots of people curious about it. So you heard lots of good tips today. Now I'm going to take us back in time. September 18th, 125 years ago, D.D. Palmer was what they call a magnetic healer at that time. In 125 years ago, medicine was one of multiple competing arts as far as taking care of people and that. And it actually wasn't so dominating at that time, 125 years ago. There was an eclectic medicine, homeopathic medicine. Grain crackers came from something called Dr. Graham, and he had Graham Institutes all over the country. People would go there to drink clean water, to eat more vegetables, to exercise. So it's funny how we've come back to saying we need to take care of ourselves. So there were multiple types of healing arts. And so magnetic, or using magnets in healing. So D.D. Palmer was in his office, and a janitor in that building, Harvey Lillard, came in and he started talking to him, and Harvey Lillard could not hear. And D.D. Palmer talked to him, and he said, I was bending over, I felt a pop in my back, and I couldn't hear after that. So D.D. Palmer told him, lay down on the table. D.D. Palmer took two hands, and the uniqueness of chiropractic is there's been bone setters for all of time. The Egyptians had bone setters and that. But what D.D. Palmer did is he took the levers of the spinous processes, transverse processes. He put his hands on the upper part of the thoracic spine. He adjusted that part where you heard an osseous crepitation, so the joint opened up. And when Harvey Lillard stood up, he could hear better. He got multiple adjustments and that he could hear better. And what's interesting is chiropractic, when it first started, was an absolute distinct healing art, and meaning that it was about health. If you go to, so D.D. Palmer lived in Davenport, Iowa. Davenport, Iowa is where Palmer College of Chiropractic started. If you look at the first 5 years of notes in Davenport, Iowa, there was not one mention about pain. It was about health. They treated people for asthma. They treated people for digestive issues. They treated the human body. And what chiropractic was about is helping the body with its own potential. They talked about health from the inside out to top down. We talked about that we could have chemical pollutants, we could have emotional pollutants, we could have physical pollutants. So it was truly at the time as let's take care of the whole body in that. So it was a distinct healing art. Had nothing to do with pain whatsoever. It was about taking care of itself. So 1895, hardly any states had license for chiropractic. And again, understand that medicine, there were tons of healing arts out there in that. You hear things like tonic water. Tonic water had quinine in it, which was something people used to help them to do better. Tons of things out there. So again, interesting time. So 1917, 1918 comes around. What hits us was similar to now? The flu. One of the biggest pandemics the world has ever seen. People that saw chiropractors survived the flu better, and we started seeing states license chiropractor. First state that licensed chiropractor was the state of Kansas, which was interesting. The last state, which was 1972 or 74, was Louisiana. So one of the biggest boosts we got was not because we were good pain doctors, that when we adjusted people with the flu, they survived much better. People would line up to see chiropractors because of the flu. So cool, because when you get the nervous system, so what part of the nervous system is pain, and what part of the nervous system tells my body how to function? Well, we're only 20% pain fibers. We're 80% information fibers. In fact, one information comes out of the spinal cord. When it goes to the organ, it multiplies. Some say by 6, some say by 12 times, that the information multiplies. An interesting study early, so osteopathic medicine at one time started a little bit ahead of chiropractic. Dr. Stills, he adjusted the spine to help the blood vessels or the blood. So the osteopath started out as a profession saying it was a lack of blood supply to the body and organs that caused disease. Chiropractic said it was a lack of nerve innervation that caused disease and dysfunction. The word dis-ease in the body. Well, so there's an osteopathic research where they took 100 cadavers, 100 people that had died. They looked at what they had died from: heart disease, stomach ulcers, stomach cancer, kidney disease, and 100 of those bodies had a dysfunction in the spine that correlated. You saw Dr. Lexi put it up earlier, but correlated to the part of the body that they died from. Like way crazy stuff. So I think that it's almost unfortunate that chiropractic sometimes thought about pain doctors, but we're truly health doctors. That's what we do. That's what we talk about: how you move, how you eat, how you transition. So now when the next big break came in South Dakota, and if you look at it, you read the papers, chiropractors went around to at that time they had institutions where they put people that had mental disabilities, and chiropractors went in there and adjusted, and many people got better. And so we saw another wave in the 30s and 40s where chiropractors also helped people, not with pain, but they helped them with anxiety, depression, things like that, through adjusting. I'm not saying by any means stop your medication, stop anything, but I'm trying to paint a picture that chiropractic is about health, not about pain. It's about trying to help the body help itself, inside out. So when Dr. Aaron talked about, if I had any other condition, pain in my teeth, I would not say that I shouldn't floss, I shouldn't brush, I shouldn't change my diet. I wouldn't take pain only for it. Well, our spine is the same thing. Anytime we have pain, my body's trying to tell you, saying something's wrong. So if I sit for a while, as Dr. Matt said, and I get uncomfortable, my body doesn't say it has a lack of painkillers. It says I'm not moving enough. It's way smart. The body is so smart that I have 12 different pathways of pain. So if I block one pathway, and you hear people come all the time, well, for a while, this medication worked, for a while this medication, then I took this prescription medication. We'll see that with migraines. So why? Because the body's trying to scream at you something's wrong, and it'll just come up with a new pathway, and a new pathway, and a new pathway. And then if I'm not working, we are just, like if somebody said, oh, there's an athlete, but his knee is really tore up, he probably shouldn't be going on it, it hurts him so bad, but we're just going to shoot it up so it doesn't hurt, and we're going to let him go out there and play. Well, what's the risk? If the body's telling we have pain, and we don't take care of it, it just starts to break down faster and faster. And when I take a pain pill, it stops healing. It stops everything. We're hearing a little bit with the coronavirus early about taking Advil and not doing as well. Well, Advil decreases your immune system. I mean, that's what it does. So it's not like we have a deficiency. So when it hurts, our body is incredibly smart. It's telling us to do something. I think also maybe one of the frustrating things is everyone kind of says, my uncle went into the doctor and he was starting to have a little chest pain, and can you believe his heart was 90% occluded blood vessels? Or somebody has kidney disease and it was 90% dysfunctional, or the liver 90%. Well, when Dr. Lexi talked about that, she was so surprised in the cadaver that the nerve was so small. This opening in this nerve takes up 10% of the opening. Same capacity the rest of the body has. So when my nerve starts to have pressure on it, I've lost 90% of the capacity of my spine. So am I going to be able to treat it once or twice? Well, if I'm going to think about, I'm just going to relieve pain, but I have a window where I have dysfunction. When somebody comes in and we take an x-ray and we look at the side of their neck and we see all this degeneration in this spine, do you think it happened there, or they had 5 or 6 windows where, I woke up one morning and my neck hurt me a little bit, my body was trying to tell me I needed to change something. I take a few Advil, I kind of go and it goes away. 2 years later I get it again. 2 years later I get it again. 1 year later, and then, oh man, it's not going away. My arm hurts so bad, I can't hardly stand it. But I did not listen to the body the whole time, and I need to listen to it. Because I would never, my tooth hurts. I'll just put painkillers on it, and then all of a sudden, it's so bad, I need to tear my tooth out and pull it out. Well, that's not how it works. We don't want to go in there and say, I'm just going to break the spine up, I'm going to take pieces out of it, I'm going to make that window bigger. Like the body won't react negatively to that. I mean, if I have a spine and I have 5 vertebrae and I make 2 of them not work because I fuse them together, what do you think is going to happen to the rest of them? It's not the answer. Sometimes do we have nothing else we can do, but it's not the answer. The sad thing, Dr. Lexi and Dr. Matt were both talking about kids. By the age of 14, kids have the same rate of back pain as adults. By the age of 14, 7% of kids are already disabled by their back. Like horrible numbers, horrible numbers. We're only I think we're 4.98% of the world's population. We take 80% of the world's painkillers. We take 80% of the world's antidepressants. Do you honestly think we have a lack of pain, a lack of painkillers, lack of antidepressants? We need to really think about taking care of ourselves. I love that Dr. Matt talked about the World Health Organization. Two things that they said are absolutely the scourge of society: lack of motion and loneliness. And what have we pushed? Loneliness and lack of motion. Like, we need to talk about it. So chiropractic in its earliest days started out as a distinct health profession. There's lots of people in the pain side of healthcare, but chiropractic is about going upstream and saying, what are we doing? I just heard, I heard a repeat of it. There's a book called Going Upstream. It's talking about healthcare. And he uses a quote I've used 1,000 times. And I heard it from a cardiologist originally. A guy walks along a stream and all of a sudden he hears somebody screaming and he looks in and there's a person floating down the stream. He pulls them out, does CPR, they start breathing. And as soon as he gets done, man, there's another body. And then there's another body. And he's pulling them out and sweating and dying. And all of a sudden comes up to him and says, he asks for help and he says, no, I'm going to go upstream and see who's pushing him in. You know, we buy more ambulances, we build more hospitals, we do more things, and we don't go upstream. Do we know that if we move more, we're healthier? Do we know if we eat better? I mean, does anybody not think that? Does anybody not think kids should run around and move? We all know that, but we have a massive learning gap. Chiropractic in its origin, 1895, was about how do I take the biggest communicator, the supercomputer that will never reproduce the brain, and get that brain that communicates to the rest of my body, every cell, every function of my body. And if something between the brain and that rest of the body gets interfered in the nervous system, how can we possibly function right? There is no way. We cannot function right. So at the micro level, it starts out just a little bit of unevenness. And I laugh. I mean, we'll take histories of people and say, yeah, I have my normal once a week headache. Like normal? Like once a week headache? Yeah, I have my normal stomach. Like, yeah, my stomach bothers me. I take a normal like everybody else does, an antacid. Like when they talk about the little purple pill, everybody knows about the little purple pill. Because like we don't digest food anymore. Like we can't do it. I just like Christmas will see these ads. Oh, I ate all this food, so I took a medicine to feel better. Like really? Like should we eat that food? Like do we think the body is like so stupid that it's not trying to tell us something? Oh, when I eat this, I get horrible diarrhea. When I do this, I throw up. When I do this. Like, we've accepted that as being normal. Can you imagine, like that we aren't, if we spent the money that we're spending shutting down the country for COVID, when we have 6 out of 10 people have a secondary health condition in their life, high blood pressure, diabetes, obesity, 6 out of 10, can you imagine that? 6 out of 10 people. When we look at healthy people dying from COVID, only 6% of people without some other health condition are dying from COVID. So if we took 200 million people dying, we look at 200,000 people dying, we look at 12,000 people healthy dying. Should not our emphasis be on what chiropractic started from the very beginning, saying, let's have healthy bodies, let's have healthy people, let's do everything we can to be healthy. So when Dr. Aaron talks about vitamin D, or Dr. Lexi talks about kids and babies, and we should not put them in walkers, we should not have a race to say, oh, my kid walked at 8 months. I mean, we know, the studies have been there since the 30s and 40s. If a kid does not crawl long enough, their hands do not go out of right to left. We do not develop the curves, but we also have more dyslexia. So when a kid walks more early and doesn't crawl as much, we see greater rates of dyslexia. When we lose the cervical spine, we see death at an earlier age. Like, again, we have to go to our origins in that. I'm really excited. I mean, in our clinic, our doctors here, we talk about, like in dentistry, there's some dentists still that might just drill and fill. There's some dentists that teach you how to floss, take care of your teeth, and drill and fill. And then there's orthodontists. They're looking at bones out of place. What do we have to do to get them in place? How do we change the health? Because the health of the mouth makes a huge amount about the health of a person. Well, in here, that's what we do. We're not just adjusting, and we're not just teaching people exercises. We're teaching health styles. We answer our phones. We want you to help you reach your potential. That's what we do. So teaching you how to move well, teaching you how to eat well, teaching you how to, all the aspects. When Dr. Matt was saying easy little exercises, taking care of your I think I ate one good meal, or I ate peas or carrots, and that was like, oh, I ate really good, and then I had fried fish. Like, we cannot think about it. Health is doing it all the time, and we are the most unhealthy nation in the world. We spend more on health care than anyone else. And when we look at the allocation of our dollars, somebody like Norway, which everybody brags about how healthy they are, they actually spend similar to the U.S. per capita on health care. They just allot it. They move it upstream. They move it into moving well, into eating well. They look at the baby being born as the greatest gift we ever had, and they teach moms classes on feeding, moving, putting babies on their stomach, letting their curves develop, letting them crawl as long as possible. A baby is born there, and we put an enormous amount of health care to get that baby to have good habits. From 0 to 12, that's where we win. That's trying to teach somebody to, I didn't bring my backpack up, but trying to teach a kid in high school to wear the backpack right, like, good luck. You have way better chance. So we have a small kid's backpack in here. We want to make sure that we center that backpack in the middle of the back. We want it up high on their shoulders, so it meets them right at the middle here. We want both straps so it's tight. I don't want it, when I see the straps loosened up and it's way down by their butt and they're walking around like, worst thing ever. So spend time picking good backpacks up for kids from day one right away. Teach them to eat good. Kids eat good vegetables if you teach them. When we take kids that have never had sugar, they love carrots, they love broccoli, they love vegetables. But when we adulterate, meaning that we change their taste buds, it takes 3 years. Once you give them a McDonald's or a fast food, or we give them MSG, or we give them sugar, or we give them candy bars, or we give them any of that, it changes their taste buds for 3 years. Kids will not take minerals, and one of the hardest things to have vitamins for kids is because they don't like the minerals. They taste horrible to them. Changes their taste buds. We have to not have them do those. So 0 to 12, that's where we win with kids. If we're going to truly go upstream and make a difference, we're going to teach kids just everything that Dr. Lexi talked about with posture. Absolutely. Would you not see like when you look at a neck, right here, there should be no bone right here whatsoever when Dr. Lexi showed that. This is where a bone is starting to stick down. She looked 2.3 centimeters. It's like a little horn or a unicorn. That we're taking all this here. The head is of an adult male, 16 pounds. When it's forward, 45 degrees, it's 60 pounds to the muscles in the body. Head doesn't change weight, but just like if I had 16 pounds here, the bowling ball, I put 16 pounds here, does it weigh less, more? No, but my muscles have to work way harder, and I get fatigued. So we bring that head forward to the point. So if I have really bad feet, then we take an x-ray and we see a heel spur, and we think, oh my gosh, that's horrible, I got a heel spur. That's the same thing we're seeing in the head right now. A skull spur that's coming down because our posture. We have never seen this in the history of time. We have the worst spines we've ever seen, and I don't think it's an accident that kids have the worst spine, more pain in their spine at younger ages than we've ever, and kids are not going to live as long as their parents for the first time in the history of mankind. Again, chiropractic has been about taking from the inside the potential of the body and helping it. We do that by taking pressure off the nerve and having the body function right. We take that by having the joints work the best they possibly can so that they go well. We take that by taking collagen and things and helping the joints repair themselves. We do that by emotionally helping people think well and move well and eat well. And that's what chiropractic started. Again, first 5 years you go into Palmer College of Chiropractic in Denver, Iowa, there was not one mention of pain, not at all. Chiropractic was a distinct health profession. That's what we still are, is we're a distinct health profession. I spent a weekend with some great chiropractors, some of the big names of our ever. A lot of them were in their 70s, 80s. I spent time with an 88-year-old chiropractor. I went to a funeral of an 89-year-old chiropractor. Those guys were just on fire, and their stories were not about insurance. They were about lives they changed, about a person that came in with MS, that through moving well, eating well, adjusting, that did way better. Somebody with Parkinson's, a baby that cried forever, rashes all over the body, psoriasis. They talked about symptoms, not pain-related, for 3 days about the difference they made in people's health. Sparkle in their eye. You see an 88-year-old guy, he says, it's the greatest gift ever. I go in 5 days a week, and I get a chance to do miracles with my hands 5 days a week. They brought a brochure up, which was the coolest brochure. So Palmer College in 1920 formed a brochure that you could buy and put in your own office. There was a stamp of a doctor in Nebraska And in there, there were 20 different MDs that became DCs because they said, in medicine, I have short-term relief. I saw all these people doing the chiropractors, and it changed their life forever, and I wanted to be a chiropractor. Testimonial after testimonial from MDs that became DCs. At that time, in the 1895, 1900, 1910, 1920, you didn't take very long to become an MD or a DC. So if you're an MD, they just went to school to be a DC. It wasn't like now where it takes 18 years to be a specialist in medicine. It takes 8 years to be a chiropractor. Much shorter windows, but man, those people just did miracles after miracles. It was interesting in some of the states, chiropractors actually got thrown in jail because the medical community attacked them, and when they got thrown in jail, the jailers let people during the flu come and see them. So there were lines of people going to see a chiropractor adjusting people in a jail cell. Craziest things ever, but that's how crazy powerful it was in that. So again, just to close up, we're going to do another talk, and we'll talk about chairs and beds and taking care of yourself. But remember what Dr. Matt said. It's little things all the time. Health is 724. It's how we sit, it's how we cross our leg, it's where we could go in the bed. We're talking about Dr. Lexi. Health starts the first day that baby comes out of the womb, and it's a one big C curve. The whole purpose of the spine, I bring my neck up, I start crawling, I bring it up. This front to back curves makes my spine 16 times stronger than it would be without it. So what happens when the neck comes forward like this? We start to see it not have that. Think about if I have a metal rod. That metal rod has no curve in it and it hits the ground. Boom! All that energy goes right up the rod. But if I put curves in that rod so it's a spring and it hits, it springs down and comes back up. The curves absorb the energy of the body. When the curves can't absorb the energy of the body, what do you think happens? Breaks down. We get micro tears and fractures in the spine. Micro tears and fractures of the spine. When the spine puts a bone that's long here, it's screaming, saying, I cannot control, I cannot stabilize, I cannot, and it gets so desperate it lays calcium down to try to protect itself because I can't take care of myself. Just think, cardiovascular conditions would kill more people in the world than anything else. Staggering numbers in that. The body does not have enough energy to take calcium and fats and other things and can't return them to where they're supposed to. So in its inability to take care of itself, it plaques them in the arteries. It hopes that eventually we take better care of ourselves and that we can take that plaque and put the cholesterol in my liver, we can put the calcium in my bones, we can move all the tissue in other places. But if we can't, it builds up and builds up and builds up. The same thing with the body. If we're not taking care of it, it eventually gets micro tears, micro fractures, and we start to close off around that nerve. And when we close off around that nerve, I have a heart attack and somebody falls over. But I'm having a heart attack of the nerve when I have pressure on it, and whatever organ that's going to, that organ cannot protect itself anymore, cannot take care of itself. And again, osteopathic study about 80 years ago, 100% of the people had a dysfunction in their spine that was related to the area they died from. We need to take care of ourselves. So again, there's nothing more important than our spine health, and it's truly spine health. We're healthcare practitioners, not disease care practitioners. I am so proud, so excited to be a chiropractor after spending the weekend with these giants in our profession and hear them just talk about the child that had a lazy eye and he adjusted it, the migraine, the person that was not able to conceive a child. And it's not that you adjust them so they can conceive a child, it's you adjust them so their body can conceive a child. If a body feels safe and healthy, it can take care of itself. If a body cannot take care of itself, we have all kinds of symptoms. So do we treat any of the diseases? No. We treat the body, help the body, one size fits you. What do we have to do motion-wise? What do we have to do structural-wise? What do we have to physical? What do we have to... I laugh. There's a whole new movement in healthcare called the my biology, the psycho and social biology, my bones and thing, social, psycho, my mental state, social, my physical surroundings and that. That's the newest movement in healthcare right now, that we need to take care of people on their psychosocial, physical. What do you think chiropractic has done for 125 years? Physical, mental, emotional. It's been what we have, health from the top down, the inside out. It's been what we've done forever. It's the greatest time for chiropractic ever. You have any questions, absolutely get a hold of us. We'd love to talk to you. Our next talk we're going to talk about and get as many people, we're going to talk about what you can do in your house to make your house as friendly as possible. We're going to talk a lot more about what Dr. Lexi said, a lot more what Dr. Matt said, a lot more what Dr. Aaron said. We'll go into more details, and we'll give you a health plan at the end of it that you can take and say, yes, I can do something with it. I thank you so much for your time. We really appreciate when you come in. If you watch this, absolutely forward this on to other people. And again, if we're going to not have to shut this country down over and over, we have to get more healthy. Can you imagine if 6% of all the people dying, only 6% are healthy? Like, what if we were all healthy? This would just be a walk in the park. But because we are so unhealthy, and our unhealthy is not genetic. Do never think it's genetic. Our unhealthy is lifestyle. And if we don't change our lifestyle, we're going to continue to have problems like we've never seen before. Again, do you honestly think that we as Americans need to take 80% of all the medication given for emotional disorders? That we need to take 80% of all the painkillers taken out there? That's 75% of all the opiates in the world are taken in the United States? No. We think health comes from the outside in. It comes from the inside out. And that's what chiropractic has been about for 125 years. So again, thank you so much. I way appreciate your time.